Well, you know what may be bad for you? Not washing your hands. Those of you who don't wash your hands, you may want to reconsider.
If you don't wash your hands after using the bathroom, you increase the chances of catching and spreading serious diseases. So do like your mother said and wash your hands.
Yeah, that's so true. And studies show about 95% of people will claim they wash their hands, but in reality, only about 2/3 of people do.
But if theoretically, as a man, for instance, you go into the bathroom, you go up to a urinal, all you touch is your business,
Right.
You urinate, and you leave, theoretically, you have not come into contact with any of these germy surfaces and things we're going to talk about.
That is a good point.
That's one where, I would. It's kind of gross, but you're not putting yourself at risk. The only thing you've touched is your.
But you can even
your business.
I want to see you get the thing released without actually touching it.
You can.
Our 4-year-old has figured that out. He tries not to touch it because he's figured, if I don't touch it, I don't have to wash our hand.
But
yes, you do,
urine
buddy.
is sterile, and that's important for people to know. So there's a big difference between the things we're about to talk about and just plain old-fashioned urine.
There's a lot of bacteria floating around in some of these bathrooms, and one of them is Shigella. It's actually pretty common. How you get that is if the bacteria gets on your hands and then you touch your mouth, you're going to get sick. And the most common symptom is bloody diarrhea. It's actually pretty common in kids. The most common age is 2 to 4. And it's pretty nasty. And treatment's usually just hydration. If it's really severe, maybe some antibiotics. But what you don't want to do is take some of those anti-diarrhea medicines because that actually just prolongs the illness and can make it worse.
Another one you can get is hepatitis A. A lot of people have heard about this, especially because of restaurants. People who don't wash their hands and then they handle your food. Not a good thing. So then that, imports that to you, and it can have really insidious side effects that you don't see for a little while, and they can be very subtle. They can be a little jaundice, like a little yelling of the conjunctiva. You can just get fatigue. Maybe your urine color will change to a dark color because this can sometimes wreak havoc on your liver. So this is not a good thing and can be very contagious. So especially if you were a food handler, that's something that you can pass on.
And the most common cause of diarrhea, they're viruses. It's called viral gastroenteritis, things like rotavirus, which can be very serious in young kids. These are all passed via the fecal-oral route. So it comes out usually in diarrhea, and we all know that when you have diarrhea, it's fairly messy. You can't control it. All it takes is getting on one surface, you touch it with your hands, then it gets near your mouth and it's spread. That's why if you use a public restroom, and God forbid the person before you had severe diarrhea, and you touch some of that virus or bacteria, if you wash your hands before you leave, it's gone. And you're not going to go infect other people or yourself. So that's why you wash your hands after you use number 2 in a public restroom. There you go, buddy.
Yeah, exactly. There's vaccines for both hepatitis A and rotavirus, so it's important.
Dr. Lisa, I'm going to give you a soap award for this segment.
Oh, why? Thank you.